Hello, I'm Dr. Joanne Hobson. I'm the Clinical Lead Director of the Menopause Consortium, and I'm delighted to have with me today our systemic psychotherapist, Liz Tatham, who works as a member of our team. And I want to explore with you today, Liz, if that's okay, some aspects of how the menopause can impact on people's mental health. So, one of the things we see in our practice that menopause often acts as a catalyst for lifetime traumas coming to, what are manifestations of this phenomenon?
Okay, I mean, I guess we sort of are aware, aren't we, that more research needs doing about sort of in terms of the links between menopause and trauma and other mental health issues. To be fair, but we sort of have a very clear idea that it can absolutely re-traumatize people. The symptoms, the life changes, can very much sort of make the symptoms worse for people. So anything that's happening to a person in that time of their life can re-trigger any past trauma that they've not really had help with, or any past trauma that is around. So people will often come to us and will say that they're having particularly bad hot flushes, they're having night sweats, all those other symptoms. But alongside that, we see symptoms of anxiety and depression. We see people having panic attacks. We hear stories about people really struggling, going to GPs, seeking medical help, being given antidepressants without any sort of sense of trying to revisit that trauma or trying to explore what actually is going on for them at that time. So that's the sort of thing that we see that we is really important to us to take notice of.
Yeah, and I think you've mentioned that word antidepressants, haven't you? And you and I are well aware that we see lots of women in their menopausal transition who have gone to see their GPs, perhaps with anxiety and depression, perhaps presenting before the physical symptoms of menopause, and are
Yeah.
offered
Yeah.
antidepressants. And women will say, "I know I'm not depressed." So, I think it's important that we note that rather than and address the underlying causes. And with you as a psychotherapist, you can help with that, can't you?
Yeah, absolutely. As you say, because those sorts of symptoms can be exacerbated. So it works both ways, doesn't it? For example, symptoms of menopause can be exacerbated and vice versa by, so mental health problems will get worse. So in terms of therapy, what we try to do is we try to work out what's going on for people without just assuming it's about menopause or without just assuming it's not about menopause. It's trying to think about all those life changes that are happening, trying to think about ways that we can navigate through those. Because again, alongside menopause, there may be lots of other life transitions. And in psychotherapy, we know that life transitions can be particularly tricky. So, for example, young people leaving, young people coming back home, divorce. I mean, what's the average? 42 to 45 people get divorced. That's the time. So that again can go very much alongside perimenopause. So lots of life transitions can be happening that need help, somebody to help navigate through and find strategies, find techniques, think about those sorts of links and think about ways forward.
Yeah, and I think that's interesting that you should have sort of led me on to my next question, really. I mean, first of all, I think we're both in agreement that antidepressants are not necessarily the quick fix, get the lady out of the consultation room. We need to
Yes.
give patients
Yes.
time. And that's one of my things. Listen, I tell everybody I teach, listen. If you listen long enough to a menopausal woman, she'll give you the solution to the problem. And you
Yeah.
also touched interestingly on young people coming and going, and it has massive impacts on relationships, doesn't it? So
Yes.
you just sort of explore that a little bit more.
Yeah. So again, all transitions, I think, apart from young people coming and going. So, for example, women, I guess, thinking about what their future is going to look like after certain changes. Again, another thing that happens very much for people at that time of life is maybe looking after a sick parent, or maybe looking after a sick partner, or again, as we said, divorce. All of those sorts of transitions, especially at a time where you're feeling maybe particularly tired or particularly on edge or particularly full of anxiety, are going to make that worse and make that transition even more tricky. So again, being able to break that down, having that time, as you said, and it's also about having a safe space to do that.
Absolutely.
When nobody's going to be listening to you, where you have that time for you to be able to explore those issues. The way that psychotherapy can work is, some people like very clear strategies, some people like techniques, other people like the cathartic, being able to talk, being able to be heard, validated, as you say. Some people like to explore and understand. So it's being able to hold on to all of those ideas and what's right for that person at that particular time. But as you say, with listening and with time, and with reflection.
And a safe space. I think that's
safe space, absolutely.
Me being a menopause doctor, I've got to bring this in. One of the things that I've seen, and as you know, I'm a member of the Institute of Psychosexual Medicine. Yeah. I see women in my clinic with a dry vagina. Okay. And we can fix the dry vagina with estrogen, but still the problems persist. And interestingly, I've brought, we've talked about things that can happen a long time in the past, which have lain dormant, which might even go back to childhood. And I think that can be a particular challenge for perhaps couples at this time.
And again, one of the things that I do as part of the work for the Menopause Consortia is that I will work with couples, I will work with families. I'm a family therapist. And again, those sort of changes, things that are happening, will impact on everybody, as will what's happening for everybody else impact on that person. It works all ways. And I think the other thing is, good psychotherapy for me should move between past, present and future. It shouldn't just focus on the past and ideas about, I don't know, there was an idea, wasn't there, of Freudian ideas about sort of mother blaming, like language. It's not about that. It's about using the past, the present and the future, and moving between all three of them, and being able to, as I say, to find ways to navigate what's happening. But those sorts of things, that the lifestyle, the changes that are happening for people can impact on so many, not just the small circle of people that you live with, but a wider group of people. And it's how to bring that into the therapy room as well. Sometimes it's really useful to have other people come in, or to invite, questions like, what would your partner say if they were here now? What would, having those thoughts about what other people might be going through as well, and what they might be thinking.
I think one of the questions that springs to mind as you were just saying that, and in our conversations, because you and I have known each other for a long time,
yes,
is you will say to me that what does that look like for you, or how does that look? How do you think that might look like for your partner? And I think we talk about having a safe place to reflect, and I think reflect is a really good word. And I think that psychotherapy can really help people reflect in a positive way and a constructive way, because we all reflect, don't we? Some of us try to do so, and that it's a buzzword. So could you just sort of tell us a little bit more about how reflection is important for, and in terms of psychotherapy being a good intervention?
Okay, I guess, I mean, sort of like anecdotally, I think we as a society, the sort of Western idea sometimes is very much about stiff upper lip. We use that sort of terminology, don't we? Putting our head in the sand, forgetting things. And actually that can be a real block for people. It can be a real wall. Like, I'm not supposed to think about this. I'm not supposed to have feelings about this. I'm not supposed to let this affect me. So again, that reflection can be a way of exploring that, if that's useful. It's not about making assumptions or thinking that everybody has to do that, but it's about listening and being there and being able to try and have different understandings, and almost finding ways to let ourselves off the hook sometimes, finding a way to understand ourselves, as you say, in a constructive way that helps us to move toward where we want to be, in order to process what's happened in the past, and maybe think about how we're going to do it differently in the future, if that's going to be useful.
And I think that's helpful, because I think that one of the other questions I really sort of wanted to ask you to give me some insights is how actually addressing the past traumas through work with you can help alleviate the menopausal symptoms and therefore improve overall well-being. And I include overall well-being in terms of not just one's sense of well-being, because well-being impacts on our lives and the relationships we have with the people in there. And if you could just talk through a little bit about that for us, I think that would be really helpful.
So we have an idea that our physical selves affect our psychological selves and vice versa. So anything that's happening to us psychologically may impact on what's happening to us physically. So, for example, as we were sort of saying a while ago, like if people are going through anxiety, depression, trauma, that will usually make menopausal symptoms much worse.
So just to interrupt there, so that an example of physical symptoms affecting, we can get severe indigestion, can't we, if we're anxious? And that's just I'm sure a lot of people can relate to and understand, but that's a good example of how a physical symptom can be a manifestation of a psychological symptom.
Or brain fog, for example. People, when we're anxious, we maybe feel like we're losing our memory, we can't make clear decisions, we're struggling to think about what's happening and describe what's happening. So again, to break that all down in therapy, to almost look at what each of those parts is about and which parts of those we can do something about and which parts of those. So things like hormone replacement therapy alongside what's happening to us can be really helpful. It's having a good holistic look at what's happening to the person. And I think that's why in our team, that's our ethos, that we have a holistic approach, that it's not just psychological, but it is psychological as well, that it's not just physical, it's all those components. It's about bodies, it's about musculoskeletal. We have a musculoskeletal specialist as part of our team. I think it's those sorts of ideas that are really interesting and are fitting together really well in a way that we all talk to each other and can refer to each other in a helpful way, rather than just thinking, well, I'm going to do this, that ticks that box, and then everything should get better, because that's not what we're seeing, is it? That's not what we're seeing at all. What we're seeing is people needing a lot of different approaches.
Lots of different. Really. And I think I'm going to have to bring the elephant in the room, so to speak, is that, you and I see a lot of women in our clinical practice in the perimenopausal, menopausal years who've put on lots of weight. Okay. Yes. And that, when you break it down, may not just be a menopausal symptom.
Absolutely.
It may well have implications of past trauma or how we feel about ourselves. And then, of course, that goes on to, how that impacts on our relationships, because we don't feel as confident in ourselves. And, I think, could you give us some insights onto how that might impact on relationships and how you can help people?
Yeah, I mean, you were talking before about like dry vagina. You were talking about a lot of the symptoms. You'll say that a lot, but you're talking about a lot of the symptoms, bodily changes, how hard that is for people to navigate, how hard that is for people to suddenly realize their bodies are changing. They don't look like they did when they were 20 years old. Things, as you say, about maybe drinking alcohol as a sort of a coping, like using alcohol to cope, maybe, so making those changes as well. But how, in terms of relationships, how people then perceive other people see them. And again, trying to bring that into the room in therapy. So the idea that somebody feels really rubbish about themselves, and actually maybe other people probably don't feel rubbish about that person. So how you have those conversations with people to help them understand that is part of the symptomatology of what they're experiencing, rather than actually what's happening around them, because that's often how they've shifted it. So being able to move to that position and be able to understand it and question it and talk about it, but alongside that, also make changes if they need to happen. So if somebody wants to lose weight, if they feel that that's impacting on their lives, we can help them do
gain weight. I mean, that's the other,
Well, absolutely. And we see both of those, don't we? And if people want to, for example, cut down on their alcohol, or if people want to have more exercise or use more mindfulness to help them sort of soothe themselves, all of those sorts of things can be brought into the therapy room and hopefully we can try and address them and work with them and be aware of them, because I think for me that is the big issue, that sometimes in medical professions we're not that aware, and we
No,
need
I
to be more.
think one of the things that I say, and I think thank you for having this conversation with me today, Liz. I think it's about empowering women, isn't it? To have
Absolutely.
the give themselves one of the things that I used to say in general practice is patients used to say to me, what's on your New Year resolution list, Dr. Hobson? And I used to say, to become second from the bottom of my to-do list. And I think at TMC, we empower women to get from the bottom of their to-do list by a whole approach. And I think, talking, with a psychotherapist is really helpful. And thank you very much for sharing time to talk with me today, Liz.
Thank you for asking me. Bye.